My husband Norm and I met with our family doctor, Dr. Tracy Hayes, on April 3rd. She admitted that she knew very little about CRPS, but confirmed that I had all the symptoms. She also confirmed that I had developed a frozen right shoulder. In spite of the fact that I was her first patient with CRPS, she helped me throughout this ordeal starting from day one. Every chance she had, she asked me to talk to nurses and interns in her office about CRPS and the chronic pain that accompanies it. She also recommended that I go to the Hand and Upper Limb Rehabilitation Center at Health Sciences North in Sudbury to see if there wasn't anything extra that could be done for me. So starting on April 18th, 2014, I started physiotherapy with Chantal for my right hand and wrist and continued at LifeMark Physiotherapy for my frozen shoulder. Chantal had a lot of experience with CRPS patients and was a godsend for me. Her colleague, Julie, an occupational therapist, also worked with me. As my sessions went on, they told me that they could not work on my hand or my wrist the way that they really wanted to because of my high level of pain and sensitivity. Both Chantal and Julie highly recommended that I go on pain medication, which would allow them to work more on my hand and wrist. So I went for a consultation with our local pharmacist, Rob, at PharmaSave to see what he would recommend, as he knew I hated to take pills or medication. On my second visit with Dr. Hayes, she prescribed Lyrica at a low dosage, 300 milligrams a day. That was a turning point for me. I could be productive again and live a lot more of my normal life. At this point, I did have 5 to 7 physiotherapy appointments a week since Bailey had added in massage therapy with Joey for my frozen shoulder twice a week. So up to 7 appointments every week for approximately 5 months on top of 2 to 3 hours of exercises at home every day. Yes, a full-time job. I needed an agenda for all my appointments and a chauffeur, my husband Norm, to drive me around. I could not drive since I could not move the stick shift up and down. In summary, do not be a martyr. Starting physiotherapy as soon as possible and getting the most out of it was key for me.